I've got 2 clients here, one in their 30s, one in their 60s. So overall, we can discover what our joints need at different stages of life. You don't have to accept joint pain and have joint related issues. This work is for anyone who wants to protect the longevity and strength of their joint. If this is what you or someone else you know has been looking for, please pass this video on. I know I've been looking for something like this. I highly encourage to explore the rest of the channel. There is something for every single part of the body. If there's not, please drop it in the comments and I'm more than happy to focus on that in the next series. Otherwise, you can always get in touch on the online community as well for something a little bit more structured to your circumstance. I hope this finds exactly what you need to keep showing up. I'll see you in there. All right, we're going to do a little bit more of the clinical aspect, legs in straps. We have Ali who's in a spine stretch. We are going to do some froggies. So whether you are on a reformer or on a mat, great time to stretch. Try and take it at your point of edge. You can set yourself up with a pillow. Ideal time to stretch is between 30 to 90 seconds. Once you hit 90 seconds, that's when the fascia starts to loosen up and change. So with our clinical froggies, we bend the knees nice and wide, keep the heels together. Nice. Then you extend the legs out and keep the knees still, so come wide. And then we're going to circle all the way around, bring the heels together, froggy circles. Yeah. Nice. Extend out. Beautiful. There's a couple of exercises we're going to do with the legs in straps. The stretching might start to feel quite intense as well. If you ever need to bring them in, have a little shake. If you want more, reach one arm under, one arm to your foot. Look at that. You can reach your toes. I want to be like you when I'm 60, Ali. She's a powerhouse. Love it. Well, some people find it hard to touch their toes. Nice, good. So what we are aiming for in our froggies is that we're pushing our hip bone or our coccyx bone down, so our core is activating and it's actually starting to build the strength. Are you finding that a little bit challenging or it's okay? Yeah. Do you feel it like in your hips? Yeah, awesome. And deep core as well. Yeah, it's a great one. Nice. We're going to do 2 more rounds. Nice. Good. Last one. Nice. And bring those legs back in with the heels together. Knees are wide. This is called Jack in the box. So we're going to extend one leg and then bend the other. So one is always moving, then lengthen one leg, bend the other. Good, and keep your headlights, your hip bones straight. Miss Ali, you're going to widen the legs, hands behind the head, and you're going to turn towards, and then turn towards the curtain. Nice and vigorously. We're getting, yeah, it might feel hips, yeah? You can prop up your hips as well. Let's have a seat on this. So lift your butt. Yeah. Awesome, and take a seat on that. Yeah, that might free up the hips. So propping up the hips whenever you're doing hip mobility stuff is just going to make it feel more spacious. Good. And this is going to be activating through the core as well as posture muscles, but we're still focused on the hippies. Good. This will be the final one for hip mobility. If you are looking for more hip stretches, you can go into the hip or rather the stretching section in this online community. You got a couple more here. It starts to feel quite internal, doesn't it? It feels quite intensity, but it's more, you can feel your pelvis working, which is pleasant for some, but you don't want to do it for too long, around those 15 to 20 reps. Nice. Start to take any other stretches you like with those straps. You've earned it. Yeah, that's a good one. Yeah, if you're obviously learning your clinical certificate, you can always come along with hands-on assist and really just help the hips kind of release here. And then Miss Ali, you got one more each side because I'm sure you're over it. You're working hard. Good. And then you're going to walk your hands as far forward as you can. I'm going to come in with a little bit of hands-on assist. Nice. Good stuff. Reach, 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 breathe. Good. We're going to hold this for 5. Good. Deep breaths. Inhale. Every time you exhale in a stretch, try and deepen. Nice. You can always wriggle your toes. Nice. Good stuff. You're here for 3 more deep breaths. Inhale. Exhale, release. Nice work. Last deep breath. Inhale. Exhale. Try and walk the fingertips a little bit more. Stretch those legs. Wriggle the toes. Oh, good stuff. That's that release that we're looking for. Well done. Slowly start to bring it up. Nice. You can unwrap the straps here. See how the hips are feeling. There are, quite a lot of strengthening exercises we can do with the hips. We're going to leave it there today. That's part 2 of this drop. And this is how we're going to build this playlist. We're going to come back to each joint, each area of the body, session by session. So you can revisit whatever you need to include in your regime to strengthen that particular joint. If an episode is helpful, please like it, please subscribe. It tells me what is needed out there. And if you're an instructor or a practitioner work with clients on their injuries, drop it in the comments. An instructor-only session is on the horizon. We're building this channel from a place of authenticity so you can keep showing up.